I'm wondering, during your time abroad, how was it? How were the cultural interactions with local groups of when you had patients from the local areas tending to them? Like, were there any cultural barriers? Were there difficulties? Like, were you able to bridge cultural gaps? How was that like?
Yes, we one of the things that we learned in the military is to be culturally competent and culturally sensitive. So several of those countries that I've been to, they're Muslim countries. So we gotta observe them. Their we gotta respect their their cultures and their tradition. So one of the hardest part is because a lot of the being in those countries like Pakistan, and I have some female nurses, military nurses that and then we have male patients. So you know the difference in their culture, so we got to respect that. So we try to when we're taking care of them, we make sure that we're aware of their cultures and their tradition. So but the army prepared us for that. So that's one great thing about being a military nurse. Being in the military is, we get training on cultural competency. I live in Germany for 9 years, while in the army, and that's also a different culture that But we always know at the back of my mind, I tell myself, I'm in their country. I have to respect their tradition. I have to, I'm their visitor. So that is something that I learned everywhere I travel.
I'm also an alternative question. I'm curious if you've also, since you've been to so many different countries too, have you experienced discrimination towards you also from patients or people from these locales?
You know, um, I would not call it discrimination. I would, I think they're just uncomfortable because they don't know what, you know, because the practice of medicine is different than the Western culture in a lot of those countries. So they're not sure of if, like what we're gonna do to them, because it's different from the way they're used to. So I like what we learn in nursing school and even in our own practice now is we got to explain everything to our patients. So that's how I approach it, because okay, one example is we were in Africa. I had to take care of a female patient, an older female patient, and when it comes to of course she was not comfortable having a male nurse taking care of her. So I have to have my translator with me, a female, and also I made sure that I have a female nurse with me taking care of that patient. So as long as you explain to them, I think they become more comfortable. But as far as discrimination, I actually in my experience in deployments, I've never had that experience, fortunately.